Hi, how are you guys today? I'm going to explain something to you that will be, I think, amazing. I find it amazing for me. This is my report from Sunnybrook Hospital, June 20th, 2022. This is my name, Mark Hayden. This is where I used to live. I no longer live there. And this is my angiogram. You can see it's my whole heart here, okay? So that's it there, and the three main arteries and several smaller ones. So last spring, I started to have heart problems, and I went to Sunnybrook. Actually, I went to my heart doctor, Dr. Dingra, and he sent me to Sunnybrook. They were thinking I may need some surgery. And at Sunnybrook, when they did an angiogram, they found that on the I guess maybe this is the right side. I call it, keep calling it the left side. 100% blocked, this ventricle. The center ventricle here is 80% blocked in the middle. And these two smaller ones, one is 100 and one is 50. And over here on the left side, it's 70% blocked, and another little one on to the side is 50. So normally we only have three. But my body, you can see, has been trying to build extra ones. It wasn't quite enough. And I believe that was because I was taking some herbal medications. For a short time, I didn't take them. I had a money issue, actually. So that's when I got really bad and when I had to go to the hospital and when they suggested after doing this angiogram that I would start to think about triple heart bypass surgery. That's what they thought it would take. So luckily, I met my good friend Grace, who you see in other videos I do. We deal with her diabetic and her memory issues. And I started to help her out, and she actually helped me out. And anyway, I was able to get my medication or my herbal supplements, and lo and behold, I no longer need heart surgery. So this letter here is from Heart Health Institute. It's from Dr. Sanjay Dingra. He's was my original heart surgeon who put in my original stent. He's been looking after me for several years. He's an amazing individual. Amazing individual. I couldn't have found a better cardiologist. I'm very lucky. Although now I have another new one. I have a team. So the new one seems to be just as amazing. So maybe you know what? Maybe this is the field that's populated with them, with excellent people, right? Who knows? But I seem to be very lucky. Very open-minded people. I seem to have run into some very open-minded people. So blood pressure today was acceptable. So this letter here was written on November 25th. Remember the angiogram was in June. This is November, okay? Follow-up visit. So I wasn't exercising, but I'm picking it up. We were doing some slow walks on the beach. Of course, I always try to do some exercise as much as possible. So I've had no recent hospitalizations or emergency room visits. Interval history, unremarkable. Cardiac risk factors, no diabetes. Blood pressure on this day was acceptable. Continues to use marijuana, and cholesterol status is being treated with herbal therapies. I use marijuana because I also have a back condition called congenital spondylolisthesis with in situ articulation, compounded by spina bifida occulta and failed mechanical back surgery. But that's a story for a different video. So that's why I started using the marijuana, though. Turns out it's great for hypertension. So, and I use herbal therapies as well as the 81 milligram daily aspirin, right? This is the pill. These are the pills I take for my conditions. Dr. Dingra, God bless him, then goes to say, on physical examination today, he was in no acute distress. Heart rate was 100 and regular blood pressure was 140/90. Head and neck examination were normal. The chest was clear. Normal first and second heart sounds. There were no extra sounds or murmurs. There was no significant peripheral edema. I'm sorry, I'm not really sure what that means. But basically, he's saying my heart was normal. In summary, Mark Hayden is a 59-year-old gentleman who has an established history of coronary artery disease with previous coronary intervention. He has had some previous issues with chest pain and dyspnea and did have evidence of significant multivesical disease at cardiac catheterization. That's the angiogram, right? Evidence of significant multivessel disease. He has been assessed by Dr. Terrell at Sunnybrook, and at the current time, I would like to continue with his current medical management. See that he wants to use my current medical management. I'm telling you, these people are very open-minded. They know they could do surgeries from now till forever and not help enough people. They want to help as many as they can, especially the ones like me who maybe don't need it so much, right? So that means that they can free up because we do all live in a world of budgets and numbers and everything. So maybe the people that really need the heart surgery can have the heart surgery. People like me can take herbal supplements. And maybe, just maybe, we can help a lot more people. Remember, I'm not a doctor. I don't have medical expertise. I am just a guy who's trying to find his way in the world, and this works for me. So, maybe talk to your doctor, do whatever you would like to do. And all I can say is I wish anybody, be the best you can be. So we're back here again. And he says, in summary, a 59-year-old gentleman with an established history of coronary artery disease and previous coronary intervention, had some previous issues with chest pain, and did have evidence of significant multivessel disease at cardiac catheterization. That's the angiogram I showed you. He has been assessed by Dr. Terrell at Sunnybrook, and at the current time, I would like to continue with his current medical management. He does not really want to proceed with bypass surgery, meaning I do not want to proceed with bypass surgery. Dr. Dinger then goes on to say, from a cardiac perspective, he appears to be clinically stable. I will plan to reassess him again in approximately 6 months' time just to see how things are progressing, but certainly would be happy to evaluate him earlier should the need arise or there be any specific cardiovascular concerns. Dr. Dingra, thank you for everything. He then goes on to say, I hope the above arrangements are satisfactory to you. Thank you again for allowing me to participate in his care. And this is a letter that he's sending to Dr. Tarola. And just the way they thank each other and the way they communicate back and forth. I'm very blessed, let's face it. And then I would like to show you the second letter, the third part of this little display here. The first part was the angiogram. The second part was the follow-up with Dr. Dingra, who put my stent in 7 years ago. And he's been looking after me ever since. And now this one here is from Sunnybrook Health Sciences Center. It's December 6, 2022. This is from Dr. Tarola to Dr. Dingra. I had the pleasure of speaking with Mark Hayden in outpatient clinic today. As you recall, he is a 59-year-old male referred for consideration surgical revascularization for coronary artery disease. That means they wanted to revascularize or do bypass surgery. His medical history is as follows. Risk factors, I don't know what that is, hypertension, a stent, I've had my spinal fusion. I told you that. I've had a tonsillectomy, appendectomy. Wow, they got everything here. External medications. Apple also takes herbal medications in place of prescription medication. I take herbal medication in place of prescription medication, partially due to affordability, but don't kid yourself. What I do is very, very expensive. Known allergies, none. Stress echo demonstrated normal valvular function and mild to moderate impairment of LV function. His angiogram demonstrates three-vessel coronary artery disease. Three-vessel coronary artery disease. If you look at my videos, you'll see that I've recently started getting on the treadmill every day. I'm doing a 25-minute walk. I'm using a 5-pound dumbbell in each arm and I'm pumping. I'm also using rolling hills on a level 4, which, it just gives you some idea what I'm doing. And I've also hit the universal gym and I've been doing a few bench presses, a few pull downs, even a few leg presses the other day. So it's really, really, I am so grateful that I found plants the good Lord gave to me, and I'm so thankful for the doctors that are there when I need them. Listen, they fixed my back. I was blind a long time ago. They put lenses in my eyes, broken bones, like I'm grateful. The doctors have been they've saved my life. And when I was blind and I had the eye surgery, I felt like I was reborn, to be honest with you. So if sometimes it appears like I'm complaining about healthcare, because there is another section I work on where I'm trying to help elderly, and I do have some complaints with the healthcare system. Please understand that there are parts of it that work splendiferously, parts of it that are just amazing. And if I could help to improve just a little bit of it, it would mean that I didn't live for nothing. So, truth, what can I say? His angiogram demonstrates three-vessel coronary artery disease. Three-vessel, all three, right? The left main shows no significant, says disease, but what it means is it's 100% blocked. And there's a 80% in the proximal. That's quite. He talks about 80%, 100%, right? And then he goes on to say, this is Dr. Tirola, God bless him, and his open. Like, you know what? If I actually have success and help people, it will be because of the people who help me. And Dr. Tirola and Dr. Dingra are definitely two of the doctors that are helping so many people. Even helping me with Grace's memory issues and her diabetes. And like, I've met some wonderful people. Thank you, Lord. I'm going to finish up here now. So, Dr. Trolla goes on to say, meaning Mark, he tells me for the last few months he has remained on his natural vasodilators. Natural vasodilators, I sure do. And his symptoms have been improving. He has occasional chest discomfort, though notes improvement since I first saw him. Denies any shortness of breath on exertion. And then the plan. Okay? So we were originally planning triple heart bypass. And to be honest with you, I was thinking I might just pack it in and let it happen. But I'm so glad the good Lord said, no, Mark, we have a job for you. You're not packing it in. And he gave me a job. So the plan, in summary, Mr. Hayden is a 59-year-old male with symptomatic three-vessel coronary artery disease. I had a discussion with him about the natural history of his pathology as well as the management options for coronary artery disease. He tells me he would like to continue with herbal remedies, and does not wish to proceed with surgery at the present time. However, he would like a follow-up in another 6 months to reevaluate. I'm open-minded too. Of course, I want another assessment. Of course, I'm thankful. Thank you again for involving me in the care of Mr. Healt, and please do not hesitate to contact me with any questions or concerns. Sincerely, Dr. Tarola. See, like, they don't take things for granted, not even with each other. I'm so lucky the people I met. But I'm also lucky that I stumbled across a couple of herbs that may mitigate the need for bypass surgery for people. This is the goal. I am going to get it somehow, try to make it available in a mass way. Always a pleasure. Have a great day.